If you're living with burning feet, stabbing pain, or that maddening numbness that makes you feel like you're walking on cotton balls, I need you to stop what you're doing and watch this video all the way to the end. Because what I'm about to share with you is something most neuropathy patients never hear from their doctors. And it could be the difference between you getting your life back or slowly losing it. Peripheral neuropathy affects over 20 million Americans, and yet most of them are walking around with the wrong information about what it is, what causes it, and what can actually be done about it. Here's what typically happens. You go to the doctor, you describe the tingling, the burning, the numbness, the sharp electrical shocks in your feet and legs. Maybe you've lost feeling in your toes. Maybe you're waking up at 3 a.m. in pain and your doctor, who genuinely wants to help you, hands you a prescription of gabapentin, Lyrica, maybe an antidepressant, and you take it. And the pain dulls a little, or maybe it doesn't at all, or maybe the side effects of the medication are beyond your ability to handle it. But here's what nobody tells you about that medication. It's not healing your nerves. It's just turning down the volume on the alarm while the fire keeps burning. Meanwhile, quietly, gradually, more nerve fibers are dying. The numbness spreads. Your balance gets worse. You grab walls when you walk. You stop going out at night. You stop doing the things you love. And you start to wonder, is this just what the rest of my life looks like? I want you to understand something. And I say this not to frighten you, but because I think you deserve the truth. Neuropathy is a progressive condition. Left untreated or managed only with medication, it gets worse over time. Not maybe, not sometimes. It gets worse. The tingling becomes numbness. The numbness becomes weakness. The weakness leads to falls, and falls for adults in their 50s, 60s, and 70s can be catastrophic. Broken hips, hospitalization, loss of independence. The CDC reports that falls are the leading cause of injury related death in older adults, and damaged, unfeeling feet are one of the biggest reasons for those falls. I'm not sharing this to scare you. I'm sharing it because there's a window of time right now where intervention can make a real difference. But that window doesn't stay open forever. The longer the nerves go without proper treatment, the harder recovery becomes. Now, here's the best part of the conversation that most neuropathy patients never get to have. Nerves can heal. Not always completely. I'm going to be honest with you, but far more than most people are told is possible. The human nervous system has a remarkable capacity for regenerating when you give it the right environment and the right stimulus. At Aniana Spine and Laser, we use a combination of therapies specifically designed to do just that. The centerpiece of our neuropathy protocol is a Class 4 MLS robotic laser. You're welcome to look that up. This is not the kind of laser that you've seen advertised at a spa. This is a medical grade dual wave laser system that penetrates deep into the tissue, stimulating circulation, reducing inflammation, and triggering something called photobiomodulation. What that means in plain English is this: the laser energizes your nerve cells at the mitochondrial level. It jumpstarts cellular repair. It increases blood flow to tissues that have been oxygen starved for years. And in doing so, it gives your nerves a real opportunity to heal. This is a whole body root cause approach, not a band aid, not a prescription pad, a real protocol designed to restore nerve function. So, what's your first name?
Johnny.
Hey, Johnny, I know that you came in here with peripheral neuropathy. So, what kind of symptoms were you feeling in your feet?
I was having the sharp shooting pains in my toes and then the numbness on the bottom of my feet. And after, I don't know, 5 or 6 treatments, I can feel a tremendous difference in it. No shooting pains, if small pains, if any. And the numbness is not as bad either.
Okay.
So. and I highly recommend it.
Okay, so if someone was suffering from neuropathy, you would tell them, hey,
Yes,
use the laser.
yes,
Okay, well,
definitely.
my name is Dr. Mark Dailey. I am a doctor of chiropractic. I am a functional medicine practitioner for over 15 years. I've dedicated this practice to one thing, helping patients get relief that lasts without drugs and without surgery. At Aniana Spine and Laser, we've helped patients who had been suffering for years, patients who had been told they just have to manage their symptoms. Finally, they are experiencing what it feels like to walk again without pain, sleep through the night, and feel the ground beneath their feet once again. We're not a big hospital system. We're not a pill mill. We're a small dedicated clinic right here in your community. And every patient who walks through our doors gets our full attention and a treatment plan built specifically for them. This isn't a one size fits all approach because neuropathy isn't a one size fits all condition. All right. So, what did you come in here with? What was the problem?
Numbness in my toes and foot.
Okay. Were you told you had neuropathy or?
We had discussed neuropathy. We didn't do testing, but we felt like that's what it was because of diabetes.
And you had all the symptoms.
Yes.
Yeah. And then, so the symptoms were the numbness, the tingling, the burning?
Yes.
Okay. And so you came in, you tried the laser. How's it affecting you?
There is no tingling. There's no numbness. Very little sensation, bad sensation since we have done the treatments.
Okay. So if someone else was struggling with neuropathy, would you recommend they try it?
Absolutely.
Okay.
Absolutely.
All right. Well, thank you so much for being vulnerable. I appreciate that. If I've said anything that resonates with you, if you're tired of the burning and the numbness, the sleepless nights, I want to make it easy as possible for you to take the first step to get better. Right now, for a limited time, we're offering a new patient neuropathy evaluation for just $97. It includes an initial foot scan. We take a thermal image of your foot looking for structural abnormalities. We do a complete consultation and a neurological examination to determine how severe your neuropathy is. And then we do a full blown laser treatment. Over 50% of the people who do the first treatment actually notice a difference before they ever leave my office. That's four components of care. Normally for $297, now for only $97. Many will ask, do we take insurance? And we do take insurance. I am a provider. Unfortunately, they choose not to pay for the laser. But this offer exists because I believe that once you experience what real neuropathy treatment feels like, once you feel the difference, you'll understand why so many of our patients say they wish they found us years earlier. So, what's your first name?
Jeff.
Hey, Jeff. So, what brought you into the clinic?
Well, my wife saw something on Facebook about what y'all do, and it's good for diabetic patients with neuropathy, and so we came over and thought we'd see what you could do,
Okay.
and we went ahead and got on the program, and it's really helped a lot.
Well, tell me what the symptoms. What were the symptoms?
Well, I had no feeling in my feet at all, and I got to the point where sometimes when I'm driving, I couldn't feel the gas pedal or the brake pedal and things like that, and my wife, got worried about if I should even drive anymore. So,
Don't strip away my independence,
right,
huh?
exactly.
Yeah. So you've had a number of treatments, and you say you're seeing good results.
I have,
Okay.
and it's just consistently got better since I started.
Okay. So if someone else was suffering with neuropathy, like the burning, the numbness, the tingling, that kind of thing, would you recommend the laser to them?
Absolutely.
Now, maybe you're thinking, I've tried things before, nothing's worked. And I hear that more than you'd imagine, and I understand the skepticism. But what I want to ask you is this. Have you ever tried a treatment that was specifically designed to regenerate nerve tissue at the cellular level? One that uses FDA cleared medical laser technology combined with a full neurological evaluation and a personalized care plan. If not, you haven't tried this. Or maybe you're thinking, I don't want to be pressured into some long, expensive treatment program. And that's fair too. And here's my promise this evaluation is about giving you information, real diagnostic information about the state of your nerves. What you do with that information is completely your decision. No pressure, no hard sell, just answers which you deserve to have. I do want to be straightforward with you about one thing. We can only accept a limited number of new neuropathy patients at this specific rate each month. Our evaluation slots are limited, and once they're filled, the offer goes away. So if you've been sitting with this pain, if you've been putting off finding a real answer, I'd encourage you not to wait. The longer you wait, the narrower the treatment window comes. Here's what I want you to do right now. Pick up your phone, call us at 205-625-3488. Tell the front desk you'd like to schedule your new patient neuropathy evaluation, the $97 special you saw in this video. That's it. One phone call. Or if you'd prefer, visit us at aniantaneuropathy.com. You'll find all the information there and can request your appointment directly. We're located at 1901 2nd Avenue East in Oneonta, Alabama, right here in your community, ready to help. You've been living with this long enough. You've managed it, masked it, and pushed through it. Now, let's actually do something about it. Call 205-625-3488 today. Mention this video, and let's find out what's really going on with your nerves and what we can do to help. I started this practice because I believed people deserved real answers and real solutions, not a lifetime of pills and just learn to live with it. You deserve better than that. Our team is here. We're ready. And for just $97, you have absolutely nothing to lose and everything to gain. Call us. We'll take it from there. God bless you, and I look forward to meeting you soon.